The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Hand and Wrist Pain by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I am a board-certified and dual fellowship trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. In this video, we will be discussing hand and wrist pain. What is hand and wrist pain? What are the most commons? What are some diagnostic tools we can use? And what are some treatment recommendations? We will give you some simple home diagnostic tools that you can use to help pinpoint what is the pain generator. We'll also give you some simple home treatment recommendations that may help you avoid that initial doctor's office visit. So first of all, what is hand and wrist pain? Obviously, this is a very large and broad topic, and we can't get into the detail of every pain generator in the hand and wrist, although we have made multiple other videos which dive into the individual sources of pain, so please check those out as well. Hand and wrist pain can be anything from carpal tunnel syndrome to tendonitis to the obvious trauma and anywhere in between. Arthritis is a very common source of hand and wrist pain, and that can affect the carpal bones at the wrist. It can affect the MP joints, the PIP joints, or the DIP joints, or really anywhere in between. Carpal tunnel syndrome tends to cause numbness and tingling along with pain. It tends to affect this part of the hand, particularly these four fingers. It tends to be more common at nighttime. Patients may have numbness and tingling or pain or any combination thereof. They tend to awaken at nighttime and kind of try to shake the numbness or pain away. Cubital tunnel syndrome is compression of another nerve. It's very similar to carpal tunnel syndrome, but that tends to cause numbness and pain into this part of the hand and wrist. Again, it can be common at nighttime. Patients may awaken and try to shake the symptoms away. Occasionally, patients will complain of weakness or clumsiness with the hand with cubital tunnel syndrome as well. Pain right along this aspect of the wrist is a very common tendonitis. In fact, it's common enough that it has a name. It's called de Quervain's tendinosynovitis, and it's tendonitis of the thumb tendons that lift the thumb up and out as they run under a tight band of tissue across here called the extensor retinaculum. Sometimes there's some swelling in this area as well. Excuse me. Pain on this side of the wrist can be very vague and very confusing, not only to patients, but sometimes to providers as well. This is called ulnar-sided wrist pain, and there's several pain generators on that side of the wrist, anything from a tendonitis of the extensor carpi ulnaris tendon to degenerative or traumatic tearing of the TFCC, the triangular fibrocartilage complex that connects the ulna bone to the radius bone. That's probably the most common cause of ulnar-sided wrist pain. Occasionally, pain down into the palmar aspect of the hand will be associated with catching or locking of a finger that has to be forcibly opened. That's called a trigger finger. That is a tendonitis or a tenosynovitis. Generally, pain at the individual joints here sometimes can be associated with swelling or a small cyst. That's typically associated with arthritis, be that osteoarthritis or rheumatoid arthritis or one of the other inflammatory arthritides in the family. Likewise, pain at the base of the thumb is a very common place for pain in the hand/wrist. That's CMC joint arthritis. Typically, that's associated with osteoarthritis, which is just a wear and tear arthritis. After arthritis at the little joints here, the DIP joints, arthritis here at the base of the thumb tends to be the second most common place in the hand to develop arthritis. Patients feel this with gripping, grasping, twisting doorknobs, twisting jar lids, that tends to be bothersome. And occasionally there's more than one pain generator going on in the hand. Occasionally patients will have arthritis and carpal tunnel syndrome, or a trigger finger and cubital tunnel syndrome. So it's really important to kind of narrow down what your pain symptoms are, and then research pain generators in that area to further narrow your focus and further hone your treatment options. Some simple self-diagnostic tools that can be performed. Again, this is very vague, and we'll discuss these really in more detail in the other videos, although palpation is really important. So you really need to pinpoint where you're sore. For example, with CMC joint arthritis, patients tend to be sore here. So if you really push around this part of the thumb, patients are typically very sore. Sometimes you can grind the thumb and you can feel a grinding noise. That's a bone-on-bone arthritis. For carpal tunnel syndrome, there's a list of techniques that can be performed to elicit carpal tunnel symptoms. But really, more than anything, for a vague and general topic such as this, just really pinpoint where your symptoms are by touch and palpation. Some simple home treatment remedies. Likewise, this is a very vague topic, and so I would really encourage you to watch the videos specific to what your main source of pain is. You really need to drill down and figure out what is causing the pain. Anti-inflammatories are never a bad place to start, as long as you can tolerate Aleve and Motrin. You may check with your primary care physician first. Anti-inflammatories can help with nerve pain from carpal and cubital tunnel syndrome. They can help with arthritic pain. They can help with tendonitis, and kind of everything in between.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.